All right, we are going to get started on my presentation. Although not perfect circumstances, this is just how it's going to have to be. I'm going to do my presentation today on Clostridium difficile. This used to be known as Clostridium difficile, but within the last year they have changed the name to Clostridioides. Most people call this bacteria C. diff, so you'll often hear it referred to as that. C. diff is a bacteria that resides in your colon. It is gram-positive and rod spindle shaped. It produces toxins, toxin A and toxin B, which I will talk about more later, and it contains endospores, making it very resistant. So this is the process of how C. diff works. The infection from C. diff normally starts with the recent antibiotic use. So here's the antibiotic use there. What happens is the antibiotics into your small intestine and kill off the good bacteria, and the C. diff, which are these purple guys, are able to flourish and can spread these toxins, which is toxin A and toxin B, and then they damage the epithelium, which is down here, and cause a yellow plaque to form. They call that pseudomembranous colitis, which causes the yellowish plaque to form over damaged epithelium and causes inflammation, which they call that colitis. But yeah, so these guys right here, these blue guys, are the endospores. When the endospores allow the C. diff to get through the stomach and through the small intestine and into the large intestine and colon, just because they are very resistant to the acidic stomach. Some signs and symptoms that may occur is fever, abdominal tenderness, loss of appetite, and nausea. The common denominator for all C. diff patients is that they will get diarrhea. C. diff can be, there we go. C. diff can be transmitted from person to person through fecal-oral route. When the bacteria gets on surfaces that are often touched, such as doorknobs or faucets, the bacteria gets spread around quickly. The best way to protect yourself and others from this bacteria is to use PPE, which we've talked a lot about lately with the recent pandemic. But the PPE is gloves, mask, and gown. And that's pretty much any protective barrier you can get so the bacteria does not get on your own personal body. Mostly important if you know somebody has C. diff. It's also crucial to wash your hands with antibacterial soap and warm water to wash down this bacteria after the bathroom and before eating. And lastly, it's really important to do terminal cleaning of bathrooms and rooms frequently. Not only just when you're healthy and on normal circumstances you should do this, but especially if you know that you have a possible case of C. diff or anybody in your family. So C. diff causes close to 5,000 illnesses a year, 500,000 illnesses a year in the United States, and roughly 15,000 deaths each year. That number has been steadily rising since the bacteria has started to spread more readily. Also, 1 out of 6 patients who get C. diff will get it again in the following 2 to 8 weeks. This would be called a reoccurrence. If the patient tested positive again in the first 2 weeks after the end of treatment, they would assume that this is the same bacteria that never went away. But if it's the new bacteria, they would say it's a reoccurrence. And that's where that statistic comes from. Lastly, 1 out of 11 people over the age of 65 diagnosed with healthcare-related C. diff infection would die within 1 month. That's roughly 9% of patients above the age of 65. I will say that the people that are mostly affected by C. diff, on a serious note, anyone can get it, but most people are able to fight it off with just normal probiotics. But people over the age of 65 living in long-term care facilities or spending long-term care in hospitals are more susceptible to this bacteria. The most common way to test for C. diff is through stool lab testing. That would be through the ELISA testing that can check for specific toxins that are released by C. diff. I might be saying that wrong, but the ELISA testing. And then there's also the complete blood count, which would test for high levels of white blood cells, which would indicate an infection in the body. Another thing that they might do is a CT scan, which would show any thickening in the intestinal wall. And then the last one would be a colonoscopy, which may be performed if the first your body is unresponsive to treatment in the first place. Colonoscopy is a scope that goes in through the anus up into the colon and does imaging inside the colon. I don't really know how else to explain it, but it just does imaging through the internal organs. The most common treatment for C. diff is antibiotics that can destroy the bacteria. If the infection is too severe, they might perform a colectomy, which is a removal of part of the colon. There are no vaccines available, and there's no lasting immunity, meaning that you can get this over and over again. There has been some leeway lately on new medicine to help with this treatment, but I will talk about that in a little bit. Some interesting facts about C. diff are that hand sanitizer does not kill C. diff. Since C. diff has spores and a very thick cell wall, they are very hard to kill. They also are resistant to heat and produce more spores when stressed out. Another interesting fact, which is also very disgusting, is that they have started performing a fecal bacteriotherapy. This is where they do a stool transplant through a nasogastric tube. This is a treatment method that will use human stool to replace the bacteria in your colon. The last thing that I'm going to be talking about today is my new data that I have found. Volterra is a clinical stage biotechnology company that is currently doing clinical testing for DAV-132. What is DAV-132? It's an oral product that is administered at the same time as antibiotics, and its goal is to prevent the antibiotics from disrupting the intestinal flora when still allowing the antibiotics to do its job. DAV-132 decreases the risk of triggering C. diff infection because it attaches to the good bacteria so that they can survive, which does not allow C. diff to flourish and attack the epithelium. Volterra has already put DAV-132 through many clinical trials and now has shown positive results on healthy adults and volunteers. At the bottom of this slide is a link, and I'm going to go ahead and click it just so that way I can show you this video. It's only about 4 minutes long, and then I will quickly wrap up my presentation. Assuming this link works. So this is the Volterra website, and right down here is a video, and I'm going to go ahead and start this video. It's only about 3 or 4 minutes long, so this will explain how DAV-132 works.
We all know antibiotics and their wonderful power to cure bacterial infections. Let's see what happens when we take antibiotics without DAV-132. When we take antibiotics orally, the antibiotics travel to our stomach and then to our small intestine. In the small intestine, the antibiotic pill or tablet dissolves, and the active molecules get into the blood. That's what drug people call absorption. In the blood, the antibiotic then travels to the infection site and cures us. But part of the antibiotic is not absorbed and continues to travel through the small intestine and finally reaches the colon. When we receive antibiotics intravenously, the antibiotic is directly injected into the blood. Part of it is filtered in the liver and transferred to the gallbladder. Then it is re-injected into the small intestine with the bile, and ultimately, some antibiotic residues also reach the colon. Hence, with both oral and IV treatments, antibiotic residues finally reach the colon. The colon contains a very densely populated flora consisting in more than 100 trillion bacteria. This normal flora acts like a functional organ of our body and is beneficial to our health. When antibiotic residues reach the colon, they kill the normal bacteria that live there. But a few antibiotic-resistant bacteria survive, as well as spores of the bacterium Clostridium difficile. As the flora is disrupted, Clostridium difficile or C. difficile spores germinate to give rise to mature bacteria which multiply and colonize the gut. Then, in some cases, C. difficile bacteria produce toxins which cause diarrhea that can be very severe and even needing surgery. This is a Clostridium difficile infection. Furthermore, C. difficile spores can disseminate in the environment. Other patients in the same hospital may become colonized and then infected. This is the most common pathway for C. difficile epidemics. According to the U.S. Center for Disease Control and Prevention, C. difficile infections are responsible for 500,000 infections and 15,000 deaths per year in the USA. And the total costs associated with C. difficile infections would exceed $4 billion. Now, how can DAV132 reduce the health and economic burden of C. difficile infections? Let's go back to the original colonic flora with no C. difficile colonization and infection. Now, we take DAV132 along with the antibiotics. Both reach our stomach and small intestine. The antibiotic pill starts to dissolve and releases the active principle, which is absorbed. Meanwhile, the DAV132 does not dissolve thanks to a special coating developed by Davoltera. Consequently, no DAV132 is released in the higher part of the small intestine, and it does not interfere with the absorption of the antibiotic into the blood. Only when the DAV132 gets to the lowest part of the small intestine does it dissolve and release active DAV132 particles. In the colon, home of the colonic flora, antibiotics arrive along with DAV132 and are irreversibly captured by DAV132 particles before they have a chance to kill the normal bacteria. Hence, the normal flora is unharmed. The antibiotics bound to the DAV132 particles are evacuated in the stool with no alteration of the bacterial flora of the colon. Of course, this mechanism will also work if the antibiotic is received intravenously. The beneficial flora is protected, and C. difficile and other opportunist pathogens cannot colonize and develop. Clostridium difficile infections are prevented. DAV132 prevents the occurrence of Clostridium difficile infections by safeguarding the integrity of the colonic flora. DAV132 safeguards the integrity of the colonic flora.
So I'm going to go ahead and stop it there. I did want to show that video, although it does put me over my time a little bit. I'm going to pull back up my presentation here. I only have one more slide, and that's just a really quick wrap up, and then I will be done here. So that's my new data. So just my conclusion. C. diff is a bacteria that flourishes when the gut flora is disrupted. It causes colitis and infection to reside. This bacteria is highly contagious and can live a very long time without a source. And there is headway for a new product that will decrease the risk of C. diff infection. Most importantly, it is so critical that people are washing their hands and being as cautious as they can, especially when they have an illness like diarrhea or vomiting or any of the other sources of illness, that they wash their hands and are cleaning their areas as best they can. I hope you enjoyed my presentation, although this was a little bit longer than normal. And yeah, so here's my references if anybody would like to do a little bit more research on C. diff. Thanks for listening. Bye.